Parkinson's disease affects more than 10 million people worldwide, and April has been designated National Parkinson's Disease Awareness Month. It's a chance to help educate the public about symptoms and treatment options. And here in our own backyard, Memorial Hermann offers all kinds of support. Joining us now with more is neurosurgeon Dr. Sam Javidan and neurologist Dr. Allison Boyle with Memorial Hermann The Woodlands Medical Center. Welcome to you both, and I want to start by asking sort of an obvious question. What exactly is Parkinson's disease?
So Parkinson's disease is a neurological condition. It's progressive. It typically affects the motor skills. You can have tremors, slowness of movement, small movements, increased tone, difficulty with gait, and then some other non-motor symptoms such as difficulty sleeping, constipation, and decreased sense of smell.
And is it true that men are actually more likely to experience symptoms from Parkinson's disease?
It is. Men are about 1.5 times more likely to have Parkinson's disease than women.
I'm reading here that there are so many common movement disorders that might affect someone's quality of life. Can you break down some of what we're seeing on the screen right now?
So functional movement disorders are usually caused by some sort of stressor that happens or some sort of has a psychological component to where your brain is kind of exhibiting movement disorders from some other stressor. Tremor can be an action tremor, so where you tremor when you're doing something, or a resting tremor where you're just sitting, and that's more associated with Parkinson's disease. Restless leg syndrome is the feeling that you have to move your legs when you're resting or trying to go to sleep. Huntington's disease is a disease where you have excessive movements, so too much movements, and some cognitive changes. Ataxia is a broad range. It just is difficulty with balance and uncoordinated. And then chorea is an excessive movement where you have a dance-like type of movement that is typically seen in Huntington's disease.
So the movement disorders list, it goes far beyond just Parkinson's disease alone. Talk about some of the most common forms of treatment at Memorial Hermann.
First, we usually start with medical management, and so we try the typical medicines for whatever the condition is. And then if we start to have difficulty tolerating the medicine or the medicine working, then we turn to surgical options.
We're seeing some video right now of some of your patients. Let's get into something called deep brain stimulation, because this is something, of course, for Parkinson's or other movement disorders, quality of life is a big deal. If people are unable to just unable to carry out their day doing basic activities, how exactly does this deep brain stimulation work?
Well, we think it works by modifying activity in the brain by introducing low currents of electricity. And it's enough current to modify the activity, but not to damage the brain. And what it does is it tends to suppress some of the most disabling symptoms of Parkinson's disease or essential tremor, which are two of the diseases that you had listed there. So it'll suppress tremor or involuntary shaking. It'll suppress rigidity or stiffness of the limbs. And it'll also, in many cases, allow people to take fewer medications and take them less often during the day.
And this treatment has often been compared to sort of like having a pacemaker for your heart, right? Just a small device is implanted in the brain?
Yeah, that's right. So there's a little battery that sort of is the size of what the old cardiac pacemakers look like, that usually goes under the skin. And then there's a tiny, very thin electrode wire that's placed with a very special technique through a small hole that enters into a very specific part of the brain. The nice thing about having the ability to offer this surgery here at the Woodlands in a more community setting is that we're trying to increase the number of eligible people who actually get the benefit from this. Some of the studies that have been done have estimated that only about 10% of the people who would benefit from this actually get it done. And it used to be more of a destination procedure that took people to very large and sometimes intimidating medical settings, where now it's become streamlined and the technology's been miniaturized and it can be done in more of a community hospital setting.
Well, it is incredible. Important to note, it is not a cure. It doesn't slow the progression, but it does dramatically improve quality of life. Dr. Allison Boyle and Dr. Sam Javidan, thank you so much for your time today.
Thank you for having us.
Thank you.
And to our viewers, if you would like to learn more about innovative movement disorder treatments, be sure to check out Memorial Hermann's upcoming webinar happening Tuesday, April 20th at 6 p.m. You can RSVP online at the website on your screen, or you can call 713-704-7100.